Hi, I'm Dr. Kelly Stanfield. In this segment, I'd like to describe to you degenerative arthritis of the spine. Before we look at arthritis, let's look at what's normal. This model is a model of two normal lumbar or low back vertebrae. You see two bones here, two healthy discs in between. If we take a closer look at the disc, what makes it healthy? There are normal, healthy ligaments around the border of the disc and normal, healthy gel inside the disc. That provides a nice pad in between the vertebrae that allows for normal movement. That normal movement also allows normal nerve flow down through the spinal cord and out through these small holes in the side of the spine through these spinal nerve roots. As we move on to phase 1 degeneration, we see that this disc space is thinner than the one that we saw in the normal vertebrae. What makes this disc space thin? The ligaments around the border of the disc are not as healthy as they once were. The gel inside the disc, as a result, starts leaking out. That thinning of the disc allows less movement between the vertebrae, and more importantly, it allows less room for the nerve flow to travel out from the spinal cord out through these nerve roots as a result of the shrinking of that disc space. The third thing that it does is causes more load on these small joints in the back called facet joints. That causes irritation. As we move on to phase 2 of degeneration, we see a much different picture. We see vertebrae that are much closer together because of a narrow disc space over time. That causes irritation to the bone and the ligaments that hold the bone together and causes bone spurring, as you can see here. As that disc space shrinks, it puts a tremendous amount of pressure on these small facet joints in the back of the spine, causing them to degenerate and be painful as well. As that disc space narrows and this vertebrae approaches this vertebrae, the nerve hole in the side of the spine shrinks also. That causes a degeneration of the spinal nerve that exits that nerve hole. The degenerative process also shrinks the spinal canal. Most of you have probably heard of spinal stenosis. What that means is the canal here in the rear part of the spine is no longer large enough to accommodate the spinal cord and the nerves that travel through it. That bony impingement on that cord causes a tremendous amount of trouble as this degenerative process progresses. As we move on to phase 3 of the degenerative process, we see almost no disc space remaining. The reason the disc space is gone is because all the gel inside that disc has leaked out. This vertebrae is now sitting directly on top of this vertebrae. As a result, there's a tremendous amount of irritation. Bone spurring is severe in this case, and there's almost no chance for normal nerve flow to exit through these spinal nerves because of the shrinking of the hole that previously accommodated the nerve. The spinal stenosis that we described is severe also. The space where the spinal cord originally occupied is now occupied by the bone spurring, both from that disc space and from these facet joints. The bad news is we only progress one direction on this scale. Spinal degeneration or degenerative arthritis only gets worse over time. The good news is if you maintain proper spinal function through chiropractic adjusting, proper strengthening, stretching, and an active lifestyle, we can stop or interrupt this where it is and allow you to maintain a normal, functional, healthy lifestyle. I hope this helps describe degenerative arthritis of the spine.